Tonight on Cronkite News, a grim warning that ICUs in Arizona could be packed this holiday season as family and friends gather during the pandemic.
Plus, the measures Valley Metro and airlines are taking to keep travelers safe during the latest COVID-19 surge.
And later this half hour on Break It Down, how Black entrepreneurs face extra challenges.
Cronkite News starts now.
Good evening and welcome to Cronkite News on Arizona PBS. I'm McSally Gopi.
And I'm Kelsey Calasi. Thank you for joining us. A shocking new model predicts Arizona's intensive care units will be packed full by next month as coronavirus infections in Arizona continue to climb. The datasets released by researchers from Arizona State University and University of Arizona show Arizona could surpass the July peak of ICU occupancy as soon as December 18th. The researchers say that's mostly because of the upcoming holiday travel season. They warn that with no additional mitigation to stop the spread of COVID-19, the latest they expect hospital capacity to be reached is between December 31st and January 11th. The model also projects, without added public safety precautions, between 600 and 1,200 more people will die from the virus by February of next year.
One ICU nurse on the front lines in Arizona is pleading with the public to stay home ahead of Thanksgiving so they have a fighting chance to properly care for those who need it. Bailey O'Carroll from our sister station in Tucson spoke to him about why he wants everyone to think twice before celebrating the holiday.
If you were at home and you knew your loved one was in a hospital bed and their life was coming to an end, how would that feel for you to not be able to be there?
Banner ICU nurse Brandon Harvison wants everyone to think twice before celebrating the holidays.
It's really hard to hold the hand of someone that doesn't get to see their family. That's a really hard thing. And to have to tell those family members that you told them, the patient, that they were thinking about you, that they would be here if they could, and that they love them.
Harvison has been on the front lines of the pandemic since it started.
At what point are you stretched too thin?
I am starting to get to a point where I really am sensing an obligation to go to work as much as possible. And there's going to come a point where it's going to be too harmful for my physical health, my mental health. I'll have to stay home.
He says he's having to make more and more sacrifices in his personal life, while others continue to enjoy theirs.
Yeah, I typically try to plan to go to Phoenix. I try to go visit family, but this year that's just really not an option. We need to stay home.
So Harvison is asking you to please think twice about your holiday travel plans, because if we don't, well, the consequences, they could be deadly.
What I worry most about is there being so many patients that we're not able to keep a safe ratio, that we're not able to care for our patients the exact way I did a year ago. And a year ago, I always felt like my patients were being taken care of exactly how they should be.
In Tucson, Bailey O'Carroll, Fox 11 News.
This morning, Arizona health officials reported 4,471 new coronavirus cases with 43 additional deaths. It was the second consecutive day, more than 4,000 new cases, and the third time over the last week that at least 40 additional deaths. Maricopa County saw the biggest jump of the four biggest counties in the state, with over 2,000 new cases and 24 new deaths being reported. Pinal County saw an additional 280 cases and 3 deaths, and Coconino County reported 130 new cases and 1 new death today. Key pandemic metrics have been rising in Arizona at a rate not seen since the first wave hit Arizona in June and July.
With COVID numbers on the rise again, Arizonans might see a change in how they get around. Nicole Long has more information on the new precautions Valley Transit is taking.
Over the past 9 months, Arizona Valley Metro has instituted regulations to make traveling safe for everyone. Communications Manager for Valley Metro, Susan Tierney, states that the traveling service has recently added new measures to counter rising COVID numbers.
We enhanced our cleaning protocols beginning in March. And with that, we do sanitizing and fogging of all of our vehicles. And then starting in November, we began adding additional cleaners out on the line. So we have cleaners at the end of the line for light rail and more cleaners along the line. And then we also have cleaners going out to our transit centers and cleaning buses when they lay over.
Valley Metro isn't the only public transportation service implementing CDC recommendations. Several airlines have also mandated masks while passengers are on board. A representative from American Airlines shared this statement with Cronkite News. American, like other U.S. airlines, began requiring customers to wear a face covering while on board aircraft beginning May 11th. We have since strengthened our policy to require face coverings be worn at airports and on board, and announced in June that we may deny future travel for customers who refuse to wear a face covering for the duration of this requirement. Along with the mask mandate, airlines have limited the amount of passengers allowed on flights and have implemented extensive cleaning procedures and hospital-grade air filters on board the aircrafts. Nicole Long, Cronkite News.
With an upcoming surge of travelers during the holiday season, public transit officials and airlines are requiring passengers wear a face covering at all times while at stations, airports, and on board any modes of public transportation.
Pfizer says within days it will ask U.S. regulators for an emergency use authorization for its COVID-19 vaccine. Earlier this week, Pfizer and its German partner, BioNTech, announced that the vaccine appears to be 95% effective at preventing mild to severe COVID-19 disease. Pfizer also said it caused no serious safety concerns. The company said in a statement that their vaccine could be available for use in high-risk populations in the U.S. by the middle to end of December. Not far behind with a potential vaccine is Pfizer's competitor, Moderna. That pharmaceutical company announced Monday that early results from its clinical trials showed their vaccine is 94.5% effective. Moderna also plans to apply for the FDA for authorization after gathering more safety data this month.
During the pandemic, underserved communities have sustained difficult times, but there have been resources to help families in need during the COVID-19 crisis. A health organization in Nevada has found ways to service their local community. Cronkite News reporter Carolina Lopez explains what they do.
Reno is known as the biggest little city in the world. It is located in northwest Nevada and has a population of 255,000 according to the 2019 census. Emily Williams of the Community Health Alliance says they opened the health center in this city 30 years ago to help those who could not afford basic health care.
Physicians in this area said there is just not enough services for people who can't afford health care.
According to the Nevada Gaming Control Board, in June there was a 50% decrease in Nevada's economy, affecting casino employees, including Reno's.
I mean, you would just be surprised about how many children have not even been introduced to certain fruits and vegetables. So we work with our local food bank, bring in some type of food each week for them to try.
According to the Census Bureau, this Hispanic population in this area is 24.1%, of which 15.9% live in poverty. Williams says her clinic focuses on helping families in need and underserved communities.
When you leave and you've said, I'm food insecure, you take home a box of food that day, and then you can visit throughout the month to get other food for your family. It's not just for, the one person that visited.
The services that Community Health Alliance offers are basic medical care, dental services, nutritional programs, pediatrics, and pharmaceutical services. During the pandemic, they have found different ways to reach communities in need. Megan Dugan, Director of Community Relations, recalls times when they had to manage to help quarantine families.
We were able to adapt and deliver that food to their house. We haven't been able to do that often, but we're willing and able to do so to ensure that families have food on their plate at night.
Community Health Alliance works with federal funds and accepts patients with or without health insurance. Their services are offered to all communities regardless of immigration status. Carolina Lopez, Cronkite News.
Turning now to election 2020. We're now learning just how much the Native American vote helped turn Arizona blue for the first time since 1996. Voter turnout on tribal land surged compared with the 2016 presidential election, with voters in precincts on the Navajo and Hopi reservations in northeastern Arizona casting nearly 60,000 ballots. That's compared with just under 42,500 in 2016. And twice as many voters cast ballot this year on the much smaller Havasupai reservation, with an overwhelming show of support for Joe Biden. According to the unofficial results, the Democratic candidate won our traditionally red state by about 10,500 votes.
Martha McSally leaves Washington today for what will probably be the last time as a U.S. Senator. When the Senate returns from its Thanksgiving break in 10 days, Democrat Mark Kelly could be the new senator from Arizona, and McSally will be a private citizen once again. But before leaving the Senate, McSally took time this week for a farewell.
As I make the trip back home from D.C. to Arizona for the last time and close out this 9-year chapter of my life, I do so with gratitude, with joy, and with no regrets.
It was a sometimes emotional address from McSally, a Republican unseated by Kelly in this election. But the former Air Force fighter pilot said she was proud of her 2 years in the Senate and 2 terms before that as a House member representing the Tucson area.
This approach, despite the division, the obstruction, and the dysfunction here in Congress, drove me to tirelessly seek common ground, to find pragmatic solutions that make a real, tangible difference in people's lives.
It was during her time in the Senate that McSally put forward Arizona businesswoman Barbara Barrett as a candidate for Air Force Secretary. Now Secretary, Barrett calls McSally a friend and exemplary leader. She told us in a statement that while in Congress, McSally has, quote, built upon her legacy reflecting the U.S. Air Force core values of integrity, service, and excellence. I wish her all the best. I look forward to seeing her again in our home state. American University professor Jason Malika says McSally faced a tough situation when she took the Senate job, appointed to fill the term of legendary Senator John McCain just weeks after losing a 2018 race to Senator Kyrsten Sinema.
She was in a no-win situation when she had to replace Senator McCain. Let's be honest. You can't just pick up where Senator McCain left off and say, I'm going to pick it. You just can't.
He thinks McSally's losses in 2018 and this year had to do with President Donald Trump's unpopularity and the popularity of her challengers.
A lot more people were displeased with how the president went. So I think it had a little bit to play in why Senator McSally was not having much success. But I also think it had a lot to do with who she was running against in some cases.
She faced challenges in the Senate as well, revealing during a Senate hearing that she had been raped while in the Air Force.
And I told the whole world in a Senate Armed Services Committee hearing that as a fighter pilot, retired colonel, and a U.S. Senator, I too am a survivor of sexual assault.
But her farewell was mostly a time to dwell on the positive.
I wish my successor, Mark Kelly, all the best as he represents our incredible state in this hallowed chamber.
McSally said that she's not sure what's next, but is proud of this chapter of her life.
It's been a true honor, Arizona. We are an extraordinary state with extraordinary people.
While the next Congress will not be sworn in until January, Kelly and McSally were not technically running for a seat in the next Congress. They were running to fill McCain's seat for the next 2 years. That means Kelly can be sworn in as soon as election results are certified, which is expected to come in by November 30th.
One of the top trending stories online today, President-elect Joe Biden's birthday. He's turning 78 years old. That means he'll be the oldest U.S. president once sworn into office. Before him, the oldest president was Ronald Reagan, who was 77 years, 11 months, and 14 days old when he left office. Biden's political career has spanned decades. He was just 30 years old when he was first sworn in as a U.S. Senator.
Coming up next on Cronkite News, a slam dunk act of kindness. Find out what the Sun's DeAndre Ayton did to thank local nurses who are overworked in the COVID era.
PBS, the place for all things British on Sunday nights. The season finale of The Trouble with Maggie Cole.
I need to tell you something. You were having an affair.
The finale of Roadkill on Masterpiece.
I've been briefed about your private life, specifically about your family.
And Secrets of Royal Travel.
This is how the other half live.
The season finale of The Trouble with Maggie Cole. The finale of Roadkill on Masterpiece. And Secrets of Royal Travel.
Sunday on Arizona PBS.
Phoenix Sun Center DeAndre Ayton recently partnered with Banner Estrella Medical Center to transform their respite rooms. Cronkite News reporter Adam Noel talked with members of Banner Estrella team about the changes that have been made.
Signed on for the rest of the season, the Rockets, it's Ayton.
Although he's been known across the NBA for his skills above the rim, DeAndre Ayton is dishing an assist to the Banner Estrella Medical Center.
Great catch from Ayton.
The Phoenix Sun Center partnered with Banner Estrella to transform the center's respite rooms.
So being able to provide them a safe space where they can remove their PPE really helped provide them an opportunity to decompress, to relax, recharge.
Among the added amenities to the new respite rooms are massage chairs, tablets with a preloaded Spotify playlist, and lots of Puma socks for the Banner Estrella team. One of the rooms was also outfitted with Suns gear, including a framed and signed Ayton jersey.
In partnership with DA is really kind of how this came to be. And the team was really overwhelmed with this particular support.
So I'm actually in the room that they added the jersey in. And it just kind of like when you come in here, it's just there's other people thinking about you.
Banner Estrella has been one of the leaders in the fight against COVID-19 here in Arizona. So far in 2020, the medical center has discharged over 1,100 COVID patients. For Kirsten Halliday, a speech-language pathologist at Banner Estrella, the ability to take a break amidst the prolonged fight is everything.
And it's just a good minute to like take your mask off and breathe. So it's just a really good way to get away from the hospital for a few quick minutes.
And this isn't the first time Ayton has partnered with Banner. During the NBA season hiatus, Ayton catered 300 meals and donated 1,000 pairs of slides to Banner Desert Medical Center. The Sun Center continues to give back to his local community.
Right at Jordan. He's attacking.
Adam Noel, Cronkite News.
The transformed respite rooms at Banner Estrella are open to all members of the medical center staff. That means they'll all be able to check out the big upgrades.
That's it for Cronkite News tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.